I would like to stress your attention for the crisis intervention for the mental health. And I have to inform you that I am for many years working as a national, at least representative, and after now national expert for the NATO, just the public health group. Why do we need a method and education for crisis intervention? Because historically, there is no doubt that the prevention and education has always been and still is the most effective approach, method, and technique for the solving all kinds of problems. Why crisis intervention? Method, supporting mental health and fit to the framework of the Hyogo frame action, especially for the third priority, education for knowledge and general civic awareness. We are used to speak about two stages. The first one is the focus, what I am speaking today on. Method derived from the psychology of health, not the clinical roots, with the preventive approaches provided immediately in situ for crisis, emergency, disasters, catastrophe, what you want. Ideally, co-shared by everyone in the form of first aid help. The crisis intervention, the second stage, is a has the professional approaches. What needed to be solved? Professionally led education for all citizens, for professional rescuers, for volunteers, for state officials, and of course for all civil society. How? Through the school curricula and general civil awareness. Principle. Crisis methodology are present it as a concept closely related to and respectful of the biosocial environment, deals with the own culture, anthropological values of citizens in global world. Basic ongoing principle. People impacted by a disaster are be threat as a normal and healthy, and not as a people overwhelmed by the situation and needing to be treated as the helpless victims. People are not ill, they are healthy, that everybody is expected to react normally to the abnormal condition. Thank you for your time and attention, and there is my contact. Of course, every education has been done by training and not to memorize some principles, rules, etc. And I will be, of course, pleased for any question to answer your question.
I had asked you a question about the relationship between the technical university and the social sciences, and if there's any collaborative work going on between the two addressing this question.
On the Technical University, I am lecturing security, HR, human resources security. And on the medicine medical faculty, I am lecturing communication, not only in crisis, but in small life crisis, like is a serious ill, death, accident, etc.
Okay, so your experience goes across the boundaries of the technical engineering side and the medical side. My question really was, are there any joint programs between the medical school and the technical university in addressing stresses from disasters?
I have to inform you that I'm working from the first floods in the big one in Czech Republic, 97, very hardly. But we are in the Central Europe, and under the historically hard influence of Austrian-Prussian thinking, and we still have no progress. I have much more progresses with India people, with Indonesia when we met on the training of NATO. NATO, now there is a financial crisis, but 2 years before and ago, they do marvelous training. And the lesson learned is a fantastic experience and what you can reach from the training. I mean that now for the global platform is very necessary to repeat, start to do and work with the third HFA priorities of, because 2015 it's very close. And 3 years, it's nothing. I don't know if in your country, but in my country, it's very, very urgent. And it's funny that, for example, the nations like the Spain, Portuguese, or in Europe, who more? It's funny that all nations which are near the sea, and they are more listening for such programs and projects than the Middle Europe, unfortunately. But